The rate of infants hospitalised for respiratory conditions has nearly doubled in the past 2 decades. It's one of 5 areas of concern highlighted in the latest Cure Kids State of Child Health report. The others are rheumatic fever and heart disease, skin infections, dental disease and mental health. At the release of the report this morning, experts discussed some of the causes for increasing rates of preventable illnesses in children, and there was one common theme: poverty. Zane Small was at the announcement.
Cold, damp and dirty living conditions are contributing to a rise in respiratory illnesses in children.
It is the mould, it is the damp housing, it's the crowding in housing that makes a real difference to the respiratory health of children.
Dr. Stuart Dalziel was part of a panel of paediatric experts who this morning discussed the findings of the latest Cure Kids State of Child Health report.
The recent data indicates that 60,000 children are admitted to hospital for completely preventable illnesses.
What we're seeing in Aotearoa is these complex intersecting layers of inequity. And I think that they end up manifesting in the health inequities we see.
The report highlights a 44% rise over the past 2 decades of children aged 1 and under hospitalised for respiratory illnesses, from approximately 90,000 in 2000 to around 130,000 in 2022. It aligns with new data from the Asthma and Respiratory Foundation that shows 1 in 5 New Zealanders are affected by respiratory illness. That's about 1 million people, and that's up from 700,000 in 2021. It is the 3rd leading cause of death in this country. But it's children living in the most deprived socioeconomic areas who have double the rate of respiratory hospitalisations.
Our rates of immunisation are meant to be 95% of our children immunised by 2 years of age. Currently, we're only immunising 78%.
The report also identifies rheumatic fever and heart disease as another major concern, particularly among Pacifica children, who are 115 times more likely to be hospitalised. Dental disease is up there too as a problem, and rising mental health issues.
We've had an increase in mental health problems, not just in New Zealand, but internationally as a result of the pandemic, but probably also social media. But I think we are not addressing that very well in this country. And I think ameliorating poverty would be one thing that we could do.
Big problems in a big report full of big concerns for the health of our littlest and most vulnerable citizens.